So today's discussion is on chapter 38. And chapter 38 starts on page 892 on your dental assisting textbook. Chapter 38 talks about restorative materials and the matrix that's used for them, as well as the wedge. And talking about some instructional objectives with this chapter, we'll explain the properties, the composition, and the manipulation of dental amalgam. We'll identify the armamentarium, or the instruments that you'll use, and the steps of an amalgam procedure. Explain the composition of composite resins, as well as the properties and manipulations of various composite restorations. And then we'll explain the use of the glass ionomer resin and resin reinforced glass ionomer, as well as other types of comprimers, which are restorative materials. So starting off, we're going to talk about the amalgam, and there are a variety of different materials that can be used to restore a tooth after the decay has been removed and liners and bases have been placed. And amalgam is composed of silver, tin, copper, and zinc mixed with mercury. And the mercury is what gives it that that type of composition or physical state where it's malleable or easy to manipulate. The components of amalgam can be used in different proportions depending on the needs of the restoration. And the mercury in the amalgam is toxic and must be handled with care. So don't ever handle the mercury or the amalgam restorations, especially before it has set, because before it has set, it's the most toxic phase. You never want to handle that without proper PPE. An amalgam is subject to dimensional change and will expand and contract over time. The material will also change under a constant load, and amalgam restorations may tarnish or corrode within the oral cavity over time. So talking about manipulation, titration is titration is the mechanical means of mixing the dental alloy and mercury together. Amalgamation is the name of the chemical reaction that takes place to form the amalgam. And special instruments are used to accomplish this. And if you see a picture on your screen there, this device here is called an amalgamator or a titrator. And what it does is it just shakes that capsule of amalgam vigorously so that that amalgamation process can take place. There are certain bonding agents which can be used to adhere the amalgam to the tooth surface, but with amalgam restorations, typically the way that they are retained into the tooth is by mechanical retention by using undercuts in the tooth. Some dentists don't even use amalgam bonding just because of that retention is mostly mechanical, but there are some bonding agents that can be used. Now I want to talk a little bit about composites. Composites are used to provide a more aesthetically pleasing restoration. As far as what they're composed of, composites are composed of an organic polymer matrix or inorganic filler particles, and also organic silane coupling agents. Composites have a low viscosity and can be applied directly into the preparation. They can also be used as sealant for pits and fissures. Packable composites are the consistency of putty and are highly viscous. They are used in areas that need a little bit more stronger restorations, such as core buildups, or especially for restorations in the posterior teeth. Manipulation considerations include the fact that composites can be bonded to the tooth. Okay, so this is accomplished first by applying an acid etch to the tooth, which is then rinsed away, leaving the tooth surface a chalky appearance. That chalkiness is because if you look at the tooth surface on a microscopic level, the acid etchant actually creates more surface area in the tooth surface, and it makes it look chalky. So because of the extra surface area that this etchant provides, a bonding agent or adhesive is then used prior to the composite material, which sticks better to an etched surface. So that bonding material is what ultimately bonds or holds the composite filling in place. So composite fillings are not held in mechanically by undercuts the way that amalgam fillings are held in place. Composite materials really rely on the bonding agents to help them stick onto the tooth. Some modifications of composite materials include macrofill composites, which are used for class 4 restorations. Microfill composites are more strong, and because they're more strong, they're used in class 4 restorations, which usually include a cusp of a back tooth. Microfill composites are used for class 3 and class 5 restorations, where there's not a lot of stress load that's required of the composites. There's also a type of composites called hybrid that are stronger and less likely to fracture. They're used in the anterior and posterior in the mouth. Just to be clear on hybrid composites, they can be used in both anterior and posterior. Glass ionomers are used as an aesthetic restoration, and they're usually only used in areas where non-stress sparing of the mouth are being worked on. So they're not suitable for areas that require extra strength or where aesthetics are super critical. The resin ionomers bond well to the tooth surface. And one thing that's nice about it is it doesn't have to be bonded to a completely dry surface, as most composites traditionally do. So because of its ease of application and its fluoride releasing properties, it is often used in geriatric or with elderly patients and pediatric patients, which are children, where compliance to hygiene might not be the best. Comprimers are a cross between glass ionomers and composites. And they need to be light cured with an ultraviolet light and will provide fluoride to the bonded cavity wall. So they are usually used for class 3 and class 5 restorations on permanent teeth. So if you can think back, which composites or packable composite, or for what is a packable composite most likely used? For which teeth? If you can remember, packable composites as opposed to flowable composites are a little bit more dense. And so because of that density, it can be used for stronger applications where for load bearing or stress bearing teeth usually require. So if you can imagine which teeth those are in your mouth, and if you guessed the posterior areas, you are correct. So not only is it used for posterior areas, but it's also used for core buildups and places requiring a resistant, strong restoration. Wedges are materials that hold a matrix in place. So the matrix is a device that creates a barrier allowing placement for the restorative materials. So it's usually just a ring that goes around the tooth that creates a wall so that the restorative materials don't leak out. So they form borders of the tooth where the materials will fill. So wedges, once again, hold the matrix band securely and prevent excess filling from escaping between the tooth and band. They come in different sizes and they're made of different things. Sometimes they are made of natural wood. Sometimes they're made of plastic, whether they be clear or colored plastic. And wedges, to be clear, they're only to be used when the preparation includes a proximal surface. So this is areas between the teeth, such as the mesial or distal surface of the tooth. So this is what a Toffelmeyer matrix system looks like. And this is the most common matrix used for amalgam restorations, and it can even be used for composite restorations. So going over the parts of it, this picture to the left here, this outer part here is, or this little knob here is the outer knob. And then we have an inner knob, and these two things control different things. So what this does, this outer knob will actually secure the band onto the Toffelmeyer itself. And the inner knob will pull this frame, or this little slotted frame here, this little vise area, it'll pull this area closer to the frame. And when it does that, it makes this Toffelmeyer matrix smaller. This frame here is just what everything is connected to. There's a spindle here, which is basically just a screw that controls the vise. This vise has a diagonal slot where the ring is will be placed into the vise. And then we have guide channels on this end of the Toffelmeyer, and there's different channels here that will be used depending on which tooth and which area of the mouth the tooth is in. And so this is what the system looks like when it's installed on the tooth. So we have the Toffelmeyer here that's holding this matrix band, which is basically a ring that slides around the tooth. And then this inner knob tightens this ring around the tooth. So the more you tighten the inner knob, the more that ring will tighten. So that wedge that you see here, when we talk about the Toffelmeyer wedge, this is what we're talking about. It's basically this little splinter. This one happens to be, it looks like it's made of wood, which is the most common ones that I see. This does two things. The most important thing that it does is it holds this matrix in place so that it doesn't move. But what it also does, it will create a contact area between these two teeth. And once we get into using this system in DEN 170, we'll talk a little bit more about how that wedge creates that contact area, which is just where those two teeth contact, and it will provide that snap when you try to floss that tooth. We also have another matrix system called a plastic strip matrix. Another word for this type of system is called a mylar. Where we have thin, transparent strip matrix that are used for composites, glass ionomers, or compomer restorative materials that are placed on anterior teeth. So this it basically looks like a thin piece of clear plastic that's used in lieu of that metal matrix ring. And this is usually used in anterior applications where aesthetics are going to be more important. And the reason why that matrix is clear is because composite restorations are always cured by an ultraviolet light, and that clear transparent material will allow that ultraviolet light to pass through and cure the materials. There's also something called a sectional matrix systems. This is a more modern version of what a Toffelmeyer matrix system can accomplish. This is usually used on class 2 restorations to restore anatomical contacts. And this is more commonly used for composites rather than amalgams. So we see this in newer offices that have kind of done away with the Toffelmeyer system. It's kind of archaic if they have a nice sectional matrix system. They're usually a little bit more expensive, but they create nice restorative contacts. So if you can think back to when we're talking about matrices, which type of matrix is most commonly used for amalgam restorations? So it was really the only matrix system that we talked about for amalgam restorations, and that's the Toffelmeyer matrix. Okay, so I hope everyone's read chapter 38. Okay, this is going to be the first chapter of DEN 170. So if you got to this video, then you opened the correct course. So good job. If you have any questions about chapter 38 or about DEN 170 at all, please don't hesitate to send me an email or ask me in class. Thanks for listening.